Hello dear listeners. My name is Darshinee. In this video I will be talking about the stigma of mental illness. 3 out of 4 people with a mental illness report that they have experienced stigma. Stigma is a mark of disgrace that sets a person apart. When a person is labeled by their illness, they are seen as part of a stereotyped group. Negative attitudes create prejudice, which leads to negative actions and discrimination. Stigma brings experiences and feelings of shame, blame, hopelessness, distress, misrepresentation in the media, and reluctance to seek and/or accept necessary help. Let us now see the impact of mental illness. A 2006 Australian study found that nearly 1 in 4 of people felt depression was a sign of personal weakness and would not employ a person with depression. For example, some mental health problems result in impaired social and coping skills required to meet the demands of a competitive workforce and for independent living. Employers also often believe that such people are incapable of competent and consequently choose not to hire them. Around a third would not vote for a politician with depression. 42% thought people with depression were unpredictable. 1 in 5 said that if they had depression they would not tell anyone. Nearly 2 in 3 people surveyed thought people with schizophrenia were unpredictable, and a quarter felt that they were dangerous. Some groups are subjected to multiple types of stigma and discrimination at the same time, such as people with an intellectual disability or those from a cultural or ethnic minority. Families are also affected by stigma, which leads to a lack of support. Stigma can also affect people with mental health problems who interact with the criminal justice system. The criminalization of mental illness occurs when people with mental health problems are dealt with by the police, courts, and jails, instead of the mental health system. They argue that this is because of inadequate mental health services funding and get tough crime policies. Individuals with mental health problems may also be afflicted in healthcare systems. For example, American healthcare system research demonstrates people with mental illness receive fewer medical services than others, and are less likely to receive the same range of insurance benefits as people without mental health problems. Stigma can also impact the individual's self. For example, through fear of social rejection, the individual may restrict their social networks, which may lead to isolation, unemployment, lowered income, and the other benefits a strong social network can deliver. Now let's see the stigma and attitudes to mental health problems in various cultures.